Hi.
Hi.
Hi, Stephanie. Good to see you. We're just here for your postpartum assessment. Let me just close the curtain, okay? And hand hygiene. Can you confirm your name and date of birth for me?
Stephanie, 10-3-89.
Perfect. How are you feeling today, Stephanie?
I'm feeling pretty good today.
And are you feeling any pain?
No.
Okay, on a scale from 1 to 10, what would it be?
Like a 0, 1?
Wow, that's great. I'm glad to hear that. Do you have any allergies?
No allergies.
Gotcha. So I'm just going to take your vitals, your pulse, your respiration, temperature, and blood pressure. So I'm just going to do that right now. Okay, everything looks good. And I'm just going to feel your pulse for 1 full minute. Okay. How do your breasts feel?
Um, they're a little tender, but not bad.
Okay, that's good. Are you breastfeeding? Have you breastfed yet?
I am breastfeeding.
Okay. Are you experiencing any heat or tenderness anywhere outside of your breasts?
No.
That's good. So I'm just gonna assess your lungs from your chest area and then your back, okay?
Okay.
All right, everything's pretty clear. I'm just gonna go ahead and assess your fundus. Okay, I'm just gonna go pull the sheet back and apply some gloves before I do that. Um, is it okay if I lift up your drape a little bit?
Yes.
Okay. So you're just going to feel some slight pressure here. So your fundus, it's 2 fingers below your umbilicus, and everything seems to be good and firm. Okay. Let's see. When was your last bowel movement?
Um, maybe 2 hours ago?
Okay. While I'm here, I'm just going to go listen to your abdomen in all of your quadrants. You're going to feel my stethoscope. It's going to be kind of cold. Okay.
Okay.
Okay. And you haven't experienced any bowel movements yet, right?
No, just 2 hours ago.
Okay. When was the last time you voided, like you peed?
At the same time I had a bowel movement 2 hours ago?
Okay. Did you experience any burn while you're urinating?
No.
That's good. And did you change your pad the last time you went to the restroom or bathroom?
Yes, I did.
Gotcha. That's good. And I'm just gonna go ahead and check your pad, okay?
Okay.
All right. So it seems like you have some moderate lochia. That's normal. So I'm just gonna discard this over here, okay? And give you a new one.
Okay.
So I'm just gonna go ahead while I'm down here. I'm just gonna go ahead and look at your extremities and check for any like swelling or edema in your like legs and your feet and toes. And your capillary refill looks good. Do you mind if I check your, I'm just gonna cover you back up. Do you mind if I check your arms and your fingers?
No, that's fine.
Okay, I'm just gonna go ahead and press on your fingertips right here. All right, everything looks good. I'm glad you're not wearing any nail polish. Thank you. And okay, everything looks pretty normal. Just let me know if you are experiencing any pain or tenderness in your breasts, and we'll see what we can do for you, okay?
Okay, thank you.
Thank you.
Hi, Alexander. How are you today?
I'm doing good. How about you?
I'm good. My name is Steve, and I'm going to be doing your postpartum assessment really quick. You're feeling pretty good today, then?
Yeah, I'm feeling pretty good today.
Could I get your date of birth?
12/17/97.
Awesome. Let me close the curtain real quick and wash my hands. And how was your sleep last night?
I'd say it was okay. I got about 6 hours.
Oh, that's not bad. Okay, so I'm gonna check your vital signs really quick, just to make sure everything's doing all well.
Okay.
Blood pressure, pulse, respiratory, O2. Everything seems to be normal. All right. Are you experiencing any pain whatsoever?
Um, a little pain, not too bad though.
On
It's
a
bearable.
scale of 1 to 10, what would your pain be?
I'd give it about a 3.
Okay. So now I'm going to pull your sheet down a little bit. I'm going to check your breast a little bit. I'm going to ask you some questions. Do you have any tenderness or anything? You feel anything on your breast?
No, not really.
Are you experiencing any cracking or discharge from the nipples?
No.
Okay. So now I'm going to check your IV site really quick just to make sure that you're not have any redness or any signs of infection. I'm going to pull the blanket down a little lower now, and I'm going to check your extremities really fast. I just want to make sure that your legs aren't swollen.
Okay.
Checking for pitting edema. Okay. Have you had a bowel movement?
I'd say about an hour and a half ago.
Okay, I'm going to listen to some bowel sounds really quick just to see what it sounds like, okay?
Okay.
Checking all the quadrants. Okay, now that we're here, I'm going to also just feel your fundus just to make sure it's okay. Can you feel that? Is it okay?
Hmm.
Okay, you don't feel any pain or anything while I'm doing this?
No, not really.
Okay. When's the last time you went to the bathroom when you went number one?
Around the same time as my other bowel movement, about an hour and a half ago.
Okay. Have you changed your pad today?
I have not.
Okay, I'm gonna check your pad really quick. Okay, everything seems normal. You're feeling okay then, right?
Yeah.
Okay. I'm gonna cover you up. I'm gonna make sure you're comfortable and warm. Your baby's doing okay?
Yeah. She's in the nursery right now.
Okay. Remember when you feed the baby, it's not a hamburger, it's a taco. Just squeeze a little
Yeah.
bit. Okay, perfect. Okay, well, thank you. I just wanted to complete your assessment. And if you need anything, please press the call light.
Sounds good. Thank you. Hi, Catherine. It's good to see you again.
Hi.
So my name is Alex, and I'm going to be your nurse again. So today we're just going to be doing your postpartum assessment, if that's okay with you.
Yeah, right
Okay,
now
I'm
is a
going to go
good
ahead
time.
and give you some privacy, close the curtains, and hygiene. So to start it off, I'm just going to go ahead and check your vital signs. Will that be okay with you?
Yeah.
All right, so I'm going to get your blood pressure, your pulse, respiratory rate, temperature, and your O2 saturation. All of it looks like it's within normal limits. All right. Have you been feeling any tenderness recently in your breast area or your nipples?
Yeah, my nipples are super tender. I kind of noticed them crack a little bit.
Have you been breastfeeding recently?
Yeah, I
When
want
was
to
the,
say the
when was
last
the
time I
last time?
did,
Yeah.
um, like maybe half an hour ago.
Did you feel pain during your breastfeeding as well?
Yeah, I kind of just noticed that like maybe if you could help me like learn to help my baby latch a little bit better. I don't know what I'm doing wrong.
Got it. I'll go ahead and teach you some more techniques after this assessment is done, but I'm going to go ahead and document what you've told me so far. I also want to know, have you also noticed any yellowish discharge from your breast coming out as well?
No, luckily.
Okay. And then are you also in any pain right now?
Um, a little bit, just kind of like mild discomfort,
On a scale of 1 to 10, how would you rate it?
maybe a 3.
And does it like radiate to anywhere else or does it just stay in one spot typically?
Kind of just like above my abdomen or like my pelvic area, lower abdomen,
Got
upper
it, got
pelvic
it.
area.
Okay. So right now I'm actually gonna go ahead and listen to your lung sounds. Is it okay if I pull down your drape a little bit?
Mm-hmm.
Okay. So your lung sounds sound good. So I'm also gonna listen to your bowel sounds. Okay. So your bowel sounds sound okay. When was your last bowel movement?
I haven't had one yet.
You haven't had one yet. Okay, and that's pretty normal after giving birth. Have you had any voiding?
I want to say the last time I went pee was like maybe an hour ago.
An hour ago. Okay. Did you feel any pain during that time or any bleeding?
No.
Okay, so that's good. So I'm gonna go ahead and massage your fundal area now. Make sure there's nothing wrong down there. Is that okay with you?
Mm-hmm.
All right. Massaging. Do you feel any pain while I'm massaging this area?
Not pain particularly, just it's kind of uncomfortable.
All right. I'm gonna go ahead. I'm gonna go ahead document all of this stuff, and I'll let the provider know. Okay. And I'm gonna go ahead check your pad right now. Have you changed your pad today?
Yes, an hour ago after I went pee.
Okay. And was there any blood on there?
Yeah, it was kind of saturated. It kind of made me feel like I was on my period or something.
So it was like mild,
Yeah.
medium-ish. All right. Sounds
Mhm.
good. I'm gonna go ahead document that as well. All right. I'm gonna go ahead and notify the provider with everything that you've told me so far. If you do need anything else, your call light is right here. And then do press it if you need us.
Okay, thank you.
Thank you.